Hello and welcome to today's Global. We start with the latest on the Omicron variant of coronavirus and confirmation that it's been present in Europe earlier than previously thought and before the variant was first reported in South Africa. That came from health officials in the Netherlands. Meanwhile, the head of the EU's Public Health Agency said 42 cases have been found in 10 European countries. The severity of the disease, though, is said to be mild. Oxford University says there's no evidence vaccines would not prevent severe disease from the new variant. But earlier, the drug maker Moderna jolted global markets when they said COVID-19 shots were unlikely to be as effective against Omicron. Well, this was the European Medicines Agency a little earlier.
I think it's very important that we continue to give the message that the current vaccines provide protection, and we need to ensure that those who are eligible for boosting get the booster doses. At the same time, we need to prepare in case there is a need to change the current vaccines, and that's work that the companies will do.
Well, let me tell you, in the last few minutes, 8 further cases of Omicron variant have been discovered and confirmed in England. That's come from the UK health authorities in the last few moments. Let's talk now to Professor Adrian Purin, who's the acting head of South Africa's National Institute for Communicable Diseases. Thank you so much for being here on the programme. Before I ask you about what you're seeing on the ground, the fact that this variant was in the Netherlands longer than we thought and before South Africa first reported it, is that what you would expect with a variant like this?
Yes, again, I think it's trying to really understand some of the evolutionary developments, and I think trying to pinpoint a particular country becomes very difficult given the nature of international travel, and this just illustrates the problem that we would have in trying to pinpoint a specific country. But yes, the rapid spread is what we expect to see, and that's what we saw with Delta as well.
Tell me what you're seeing currently in South Africa. You're looking at the data. What is happening on the ground?
Yes, so from the data, we can certainly see that there's been a dramatic rise in the numbers, in particular in the Gauteng province, where I'm currently. The other provinces are starting to show, not to the same extent, but in terms of the incidence, that's the numbers of cases per 100,000 are certainly increasing. But Gauteng in particular has a very dramatic increase in the actual numbers of cases. I think there is some evidence to show that hospitalizations are increasing, but that has not been as dramatic as we are seeing with the actual numbers of cases.
I read there's been an increase in reinfections. Is that worrying, and why might that be happening?
Yes, so in fact, that was one of the clues to the fact that that there was a likelihood of a variant, and that there was the so-called laboratory-based evidence, as well as the fact that there was an increase in reinfections, and that is worrying because that would indicate that possibly this particular variant may well be evading the immune system. But we also need to know and understand whether or not it's also equally transmissible. And maybe that combination may explain what we are currently seeing in Gauteng. But I think the laboratory data will probably show that a bit more clearly, at least.
Professor, I don't know if you can stay with us, but I'm going to break away from our interview for a moment or two to go and hear from Boris Johnson, the British Prime Minister, who's just started the latest briefing. Let's listen in.
The target that we've set ourselves is to offer a booster to everyone eligible by the end of January. And as with the first jabs, we'll be working through people by age group, going down in 5-year bands, because it's vital that the older and the more clinically vulnerable get that added protection first. So even if you've had your second jab over 3 months ago and you're now eligible, please don't try and book until the NHS says it's your turn. We've already done almost 18 million boosters across the UK, but we've got millions more to do to protect the most vulnerable. Then we'll move down the cohorts rapidly, and working together with the devolved administrations, we want to ramp up capacity across the whole United Kingdom to the levels we achieved in the previous vaccination effort. We're going to be throwing everything at it in order to ensure that everyone eligible is offered that booster in, as I say, just over 2 months. Across England, we'll have more than 1,500 community pharmacy sites vaccinating people near where you live. All of our sites will increase their capacity and will stand up extra hospital hubs on top of those already active. There'll be temporary vaccination centres popping up like Christmas trees, and we'll deploy at least 400 military personnel to assist the efforts of our NHS, alongside, of course, the fantastic Jabs army of volunteers. I know the frustration that we all feel with this Omicron variant, the sense of exhaustion that we could be going through all this all over again. But today, I want to stress this. Today, that's the wrong thing to feel, because today our position is and always will be immeasurably better than it was a year ago. What we're doing is taking some proportionate precautionary measures while our scientists crack the Omicron code, and while we get the added protection of those boosters into the arms of those who need them most. So we're going to get behind the men and women of our NHS who've saved so many lives on the front line and run our vaccination programme for a year almost without a break, as they have, and who are going back into the breach yet again. And I want to say, on behalf of the entire country, a thank you to each and every one of them for their extraordinary efforts. And the best way we can all show our gratitude is by doing our bit and stepping forward when our time comes to get that booster. I've been waiting patiently for my moment to come, and it's happening on Thursday, I'm pleased to say. So whenever your turn comes, get your booster and ask your friends and your family to do the same. It's time for another great British vaccination effort. We've done it before, and we're going to do it again. And let's not give this virus a second chance. Thank you very much. I'm going to hand over to Saj.
Thank you, Prime Minister. A year ago this week...
Well, they will come away for now. We'll keep an ear on that news conference. If there are more significant lines, we'll return to it. Boris Johnson saying that he has set a target to offer a booster jab to all eligible people by the end of January. So a couple of months, a huge logistical task, but that booster to be offered to all eligible people by the end of January. Let's, as promised, go back to South Africa and talk to Professor Adrian Purin, who we broke away from to hear the British Prime Minister. Interesting there that the push again around vaccinations, this time the booster jabs, with the gap no longer being 6 months but 3 months. Your thought on that and the basic divergence between the vaccination programs in the richer countries and what we're seeing currently going on in poorer places like the continent of Africa?
Yes, it's quite a stark set of discussions that is being held in the UK versus South Africa. I think in South Africa, at least, I know that there are vaccines available. I think one of our major challenges here in South Africa is really trying to get people vaccinated. And I'm hoping that this particular Omicron variant will certainly serve as a spur in terms of people being vaccinated. I think we're not even really talking about boosters. We certainly are focusing on the healthcare workers with regard to boosters. But you're quite right, in the rest of the continent, the extent of coverage of vaccination is not where it should be. And I hope that those targets will be met. But it's really been very challenging when you contrast those particular conversations. Because I think without marked coverage of vaccines, I know we're not even talking about herd immunity anymore. We're talking about marked coverage of populations. And if that doesn't happen, I'm afraid we're going to see these types of events, such as Omicron, arising, unfortunately.
In terms of the vaccines, how long do you think it will be before we know whether we're in the territory of tweaking the current vaccines or having to develop new ones? And as we wait to get more data on this new variant, what do you think the focus should be on?
So I think the focus is really around, at least in South Africa, I think it's really still the focusing on the implementation of the vaccine program and the non-pharmaceutical interventions. With regard to vaccine development, I think what is critical there is to really try and understand, both from an epidemiological perspective as well as from a laboratory perspective over the next 2 to 3 weeks, whether or not the vaccine will still provide protection against severe disease. I think that'll be really an important set of data to have. I think Certainly, some of the companies have indicated that they're able to tweak, but I think the duration there is about 100 days or thereabouts to get to that particular point. And I know that there are ongoing vaccine development programs, and perhaps we should be looking not only at the spike protein, but maybe look at other proteins within the virus structure that may also lend itself to protection.
Professor, we have to leave it there, but thanks so much for joining us, and thanks for your patience to just wait for the end of what we took from Boris Johnson. Thanks so much for your time.